plays a role in thyroxine synthesis and amino acid metabolism, and helps in the absorption of iron.
Citrus fruits and their juices are excellent sources of vitamin C. Broccoli, tomatoes, strawberries, cantaloupe, guava, mango, papaya, and peppers are also good sources.
Vitamin C deficiency disease is called scurvy. It used to be a big problem for sailors who didn't have access to fresh food for long periods of time. Therefore, the British Navy started supplying lemons and limes to their sailors to prevent scurvy.
Symptoms of scurvy include bleeding gums, loosened teeth, rough skin, blotchy bruises, and failure of wounds to heal. Claims that large amounts of vitamin C can prevent or cure the common cold have not been substantiated. The only research evidence to support those claims shows that those who took vitamin C supplements had colds that were 1/10 of a day shorter. That translates into 2.5 hours shorter. Not exactly a big deal for most cold sufferers.
Speak for yourself.
It is possible to ingest too much vitamin C. Excess consumption increases the risk of kidney stones, diarrhea, abdominal cramping, the destruction of vitamin B12, and interference with anti-clotting drugs.
Let's look at these vitamins once more before we move ahead. Vitamins are micronutrients. They prevent deficiency diseases and support optimal health. There are two kinds of vitamins, water-soluble and fat-soluble. The water-soluble vitamins tend to be absorbed directly into the blood. The fat-soluble vitamins travel first through lymph and then the blood. The fat-soluble ones are A, D, E, and K. The water-soluble vitamins are the B vitamins and vitamin C. The major roles of vitamin A are promoting vision, promoting cell differentiation, and supporting the immune system. The major role of vitamin D is to promote normal bone mineralization. The major role for vitamin E is as an antioxidant, which means that it prevents the destruction of cells. The major role of vitamin K is to promote blood clotting. The B vitamins are thiamine, riboflavin, biotin, B6, folate, and B12. These B vitamins help the body use the energy-yielding nutrients like carbohydrates, fats, and protein. And vitamin C, or ascorbic acid, is essential in collagen formation.
Section B, minerals.
The second of the two micronutrients are minerals. Minerals are inorganic elements, which means that minerals don't come from plants or animals. The two major functions of minerals are, first, building body tissue, and second, regulating body processes. Minerals such as calcium, phosphorus, magnesium, and fluorine contribute to bone tissue quality.
Minerals are not of plant or animal origin, and although they're essential, minerals are needed in small quantities. There are two categories of minerals based on the amount needed daily. The first, macrominerals, are those needed in quantities of 100 milligrams per day or more. The second, microminerals, are needed in only very small amounts. Macrominerals include calcium, chloride, magnesium, phosphorus, potassium, sodium, and sulfur.
Next, the microminerals or trace minerals are needed in very small amounts. The essential trace minerals are iron, iodine, fluoride, selenium, zinc, manganese, cobalt, copper, molybdenum, and chromium. Be careful when it comes to magnesium and manganese. The first one, magnesium, is a macromineral, while the second one, manganese, is a micromineral.
Minerals are required in many essential compounds that regulate bodily functions such as hormones and enzymes. Dissolved minerals are responsible for nerve impulse transmission and muscle contraction.
The recommended dietary allowances do not include all known minerals. There are recommendations for calcium, phosphorus, magnesium, iron, zinc, iodine, and selenium only. This is because minerals interact with each other, and our knowledge is incomplete about the usefulness of all minerals.
Now, let's look at each of the macrominerals.
First, calcium is the most abundant mineral in the human body. In addition to its critical role in bone and tooth formation, calcium is also needed for blood clotting, permeability of cell membranes, transmission of nerve impulses, contraction and relaxation of muscles, enzyme activation, and absorption of vitamin B12.
Second, phosphorus is significant in bones and teeth.
It's also required for energy metabolism, enzyme formation, acid-base balance, and the absorption and transportation of fats and fatty acids.
Third, sodium is another essential mineral. Although we usually only hear about the health risks associated with consuming too much sodium, it's required for life. Sodium is needed to transmit nerve impulses, to aid muscle contraction, to maintain fluid balance in the body, and to promote glucose absorption and cell permeability. The American diet is loaded with sodium, so meeting the recommended minimum intake is not a problem. It's excess sodium that's the problem.
Fourth, potassium works with sodium to maintain an appropriate fluid balance in the body. Some Americans have been known to deplete their potassium levels through excess consumption of alcohol. Alcohol is a diuretic and may result in the kidneys excreting too much potassium. This situation can be corrected by consuming some potassium-rich foods, such as bananas or orange juice, or maybe just drinking less alcohol. Potassium is also used for nerve impulse transmission and muscle contraction, energy metabolism, glycogen and protein synthesis, and blood pressure maintenance.
The last three macrominerals, magnesium, chloride, and sulfur, work in conjunction with other minerals. Magnesium activates energy and mineral metabolism. It also helps regulate nerve stimulation and muscle contraction. Chloride assists in maintaining the water and acid-base balance. It's also a requirement for the hydrochloric acid used in chemical digestion in the stomach. Sulfur is a component of the protein in every cell. It's obtained through the consumption of protein, and it also smells really bad, like rotten eggs.
Now let's look at the microminerals, or trace minerals.
First, iron. The fact that iron is a micromineral may lead you to underestimate its importance. A small volume of iron performs critical functions. Iron is part of the compound hemoglobin that carries oxygen from the lungs to the cells of the body.
If the body's need for iron is not met, anemia may result. In this situation, the oxygen needs of the body tissues are not met, resulting in paleness, lethargy, and fatigue.
Next, iodine is required for normal functioning of the thyroid gland. This gland produces hormones for energy metabolism, growth, and development. Most people use iodized salt to obtain adequate amounts of iodine. Insufficient iodine intake often manifests itself in the formation of a goiter, an enlargement of the thyroid gland that swells in the neck.
The next micromineral, fluoride, is used interchangeably with the term fluorine. Fluoride is a component of bones and especially teeth. Many areas fluorinate their water supplies, reducing tooth decay by 50 to 60%. Excessive fluoride can cause spotting of the teeth and bones, as well as kidney, muscle, and nerve function damage.
Other trace minerals perform important functions in the body. Selenium is essential for the proper functioning of the thyroid gland. So if you don't want a goiter, don't short yourself on selenium. It's also important for proper functioning of the heart. Zinc plays a role in protein synthesis, carbon dioxide transport, and use of vitamin A. Manganese is important in blood formation and tendon and bone structure. Cobalt plays a part in red blood cell formation. Copper is required for iron use. Molybdenum is involved in the metabolism of fats. And chromium is necessary for normal insulin activity, which regulates blood sugar levels.
Okay, so let's take another look at minerals. Minerals are inorganic elements, and they have two major functions. First, they help build body tissue, and second, they regulate body processes. Necessary for proper nutrition, minerals are divided into two categories, macrominerals and microminerals. The macrominerals are needed in quantities of 100 milligrams per day or more. The macrominerals include calcium, chloride, magnesium, phosphorus, potassium, sodium, and sulfur. The microminerals, or trace minerals, are needed in very small amounts. The essential trace minerals are chromium, cobalt, copper, fluoride, iodine, iron, manganese, molybdenum, selenium, and zinc. Minerals are required in many essential compounds that regulate bodily functions, such as hormones and enzymes. Dissolved minerals are responsible for nerve impulse transmission and muscle contraction.
Supplements in the United States are big business. This industry grosses approximately $4 billion a year. But foods still have much more nutritional value than supplements. Some people, however, find it impossible to obtain their needed nutrients from food. In such cases, a multivitamin can be used. When choosing a multivitamin, two major things to consider are form and content.
First, let's look at form. When choosing a multivitamin, you have the opportunity to select the form you prefer, chewable, liquid, or pill. You'll want to select a brand that meets the U.S. Pharmacopoeia, or USP, guidelines, which suggests that supplements should completely disintegrate within 30 to 45 minutes. The USP establishes standards for quality, strength, and purity of supplements.
The second thing to check when choosing a multivitamin is its content. Make sure that the multivitamin has the vitamins in the proper dosages that you need.
As far as content is concerned, you will want to select a supplement with vitamins and minerals in amounts that are less than, equal to, or very close to the RDA. Do not select supplements that provide more than the RDA of vitamin A or D or any mineral. Avoid any supplement that provides more than 10 times the RDA for any nutrient.
Except for menstruating women, doses of iron should not exceed 10 milligrams. In general, avoid high doses. Remember that more is not necessarily better. The RDA is plenty. Excess vitamins and minerals can be just as devastating as insufficient quantities.
Think of it this way. If it's cold outside, I'd tell you to wear a hat, coat, gloves, and scarf. And if you wanted to be a little warmer, I'd tell you to put on some long johns first. Now, if I wanted you to be healthy, I'd tell you to eat 4 to 6 small meals a day. And if you wanted a little extra help, I'd tell you to have a multivitamin that doesn't exceed 100% of the RDA.
What would happen if you go outside in just your long johns, you may ask? Well, you freeze your butt off. You see, the long johns don't replace the hat, coat, and gloves, just like the vitamin and mineral supplements don't replace the 4 to 6 small healthy meals. You see, the long johns supplement your outerwear, just like the vitamins supplement your meals, hence the name. Got it?
I got it. Now try to ignore the fantastic claims and attractive packaging of vitamin supplements and focus on the form, content, and price. Remember, the RDA provides guidelines for all necessary nutrients. Local or store brands often cost a lot less than national brands, and they usually contain the exact same ingredients.
Now that we've covered both the macro and micronutrients, it's time to cover the last nutrient. It's neither macro nor micro, it's water.